Hello, I'm Ty from Leadership Initiatives. What's your name?
Tarik, how are you doing today?
I'm doing great. And how you doing, Mr. Doctor?
Well, fine, thank you.
Oh,
Dr. Tarik.
okie dokie.
So
And
you are going to be our doctor for today,
yes,
and
I am.
I,
Uh,
uh,
o-
alongside, we will diagnose this lady right in front of you. Okay?
Okie dokie. Sounds good. And you're going to be translating, Doctor?
Yeah, sure, sure.
Okie dokie. Sounds good. All right. Could you ask the
All right.
patient her name for me?
Okay. All right. Uh, well, she speaks English actually, but
Oh,
I'm
okay.
going to be asking her in English. Yeah. All
Okay.
right. So, what's your name? Okay. So her name is Miracle.
Nuraku. Okay. So could you ask Nuraku how's her day going?
Miracle, how is your day going? Harry wants to know how your day is going. Paige said her day is going fine, going well. So
Okie
okay.
dokie. That sounds good. And could you ask Nuraku, does she do anything for work? Anything like that? Stays at home, goes to school?
Do you stay at home? Do you go to school? He goes to school.
Goes to school. Okay, that's great.
Yeah.
Uh, does she have any siblings?
How many siblings do you have? How many sisters? How many brothers? Okay. She has nine siblings.
All right, that's really nice. And does she have a lot of older siblings, younger, or is she right in the middle?
Okay. Do you have lots of older siblings or younger? We are in the middle. She has a lot of older siblings.
Okay, okay, that makes sense. All right, so could you ask her what the problem is, doctor? Why she came in?
Okay. All right. So why did you come to the hospital today? Yes. Okay. So she has been having a fever, a
Mm-hmm.
headache, and a
Okay.
sore throat. Fever,
Fever, headache.
headache, and a sore
Okay,
throat.
sounds good.
Yeah.
Okay, so I'll start with that fever. Could you ask her how long that fever's been going on?
Okay. A fever for how long? 3 days.
Okay, and over these 3 days, has this fever been on and off? Has it been coming and going, or has it just been there the whole time getting worse?
It comes and it goes.
It comes and it goes. Okay. Okay.
Yeah.
Sounds good. And the headache, is the headache persistent or does that also come and go?
It comes and goes.
Okay. Okay. And that sore throat, does she feel any chest pain, anything like that when she's breathing?
Any chest pain? Any difficulty in breathing? No chest pain, no difficulty in
Okay.
breathing.
And does she have any sort of runny nose, any bad cough, anything like that?
No runny nose, no cough.
Okay. Okay. Sounds good. Okay. And has she been having any kind of GI issues, diarrhea, vomiting, constipation, anything like that?
No abdominal pain, no diarrhea, no constipation, no vomiting, no nausea.
Okay.
None
Has
of
she been
that.
feeling tired at all?
No, not really. Not that she mentioned.
Okay. Interesting. And any past history medication, anything that she's been taking helps, makes it worse, anything like that?
Nope. No significant history.
Okay. And does she have anybody in the family right now, presenting similar symptoms, anything like that?
Nope. Nothing like
Oh,
that.
okay. Doctor, could you ask her if she lives by any water, any still water, anywhere where there might be a lot of mosquitoes present?
Okay. It really is around stagnant water or bushes or hmm? Where you live, close to your house. Do you have where water gathers? Akwai inda ruwa yake taruwa a wurin ku? Ko drainage haka? Kan dutse? Okay. And they live in a swampy area.
She lives in a swampy area?
Yeah, she does.
Okie dokie. All right. So does she have any sort of chills, any weird cravings, anything like that? Confusion, dizziness?
No, 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 no confusion, no cravings, no dizziness,
Okay. Okay. And you said no cough, right?
no cough.
Okay. Okay, okay. So I think I'm ready to give a diagnosis, doctor. So I'll go ahead and
Yeah,
I'll say
please
the
go ahead.
diagnosis. Okay, so I'm gonna say she
Okay,
has a minor upper respiratory tract infection based off her
okay,
sneezing and sore throat, and I'm gonna say she has malaria based on her on and off fevers and headaches.
awesome. Okay,
Okay. And for the malaria, I'd like to do blood diagnostic test, rapid diagnostic test. And then for the upper respiratory tract infection, a throat swab.
Fine. So
Okay,
your throat swab is positive for bacterial ARI, and
okay.
then the RDT is positive for malaria.
Okay, okay, sounds good. So for the malaria, I like to put on ACT. And for the upper respiratory tract infection, the ARI, just supportive care, fluids, hydration, rest, everything like that.
Okay, perfect.
Okay, okay. And for further prevention in the future, could you tell her for the upper respiratory tract infection, she's gonna need to do her best to keep her hands away from her face, washing the hands as much as she can. When she's coughing, sneezing, coughing to the elbows, be careful of those bacteria. That's the way it spreads.
Perfect. Okay. All right.
Okay.
I'll do that.
And then can you also tell her for the malaria doctor, she needs to do her best to stay away from the mosquitoes. I know she lives in a swamping area. It's hard, but any still water she can get rid of in the bushes or anything she can take out, her family can take out. Tell her to do that. And if she can get any nets, any sort of mosquito spray, anything like that. I know it's hard. I know it's hard to get, but you can always resort to the last resort. The clapping. I'll kill the mosquitoes whenever you see them. Try to keep them away from you. Can you tell her that, doctor?
All right. Excellent, Tarik. You've done wonderfully well. I really like that clapping part.
Okay, Dr. Sadiq, I
All
appreciate it.
right.
Thank you
Thank
very
you
much.
very much for
Okay, you tell her
diagnosing
have a
me
good
right
day,
for today.
doctor.
All right. Do have a
Okay,
wonderful day. Please wave
thank you.
him.
Have a good one.
All right. Bye.
Bye.